Welcome to a deep dive into, well, the cutting edge of surgical oncology. And look, we're not just going to, geek out over the latest gadgets, though. Trust me, there are some seriously cool ones out there.
It really is a remarkable time to be in the field. The advancements we're seeing, it's like...
It's like science fiction.
Exactly. And it's all coming together, The technology, the surgical skills, a deeper understanding of how cancer actually works. It's pretty amazing.
And that's what we're going to unpack today. I was listening to this podcast, Surgical Oncology, Innovations and Best Practices, and it really got me thinking. It wasn't just about the what, like what's new, but the why. Why are these changes happening, and what do they actually mean for patients? So to help us break it all down, I've got just the person. Welcome to the deep dive.
Glad to be here. Let's dive in.
Okay, so before we even get to the operating room, it seems like imaging tech is doing some serious heavy lifting these days. What's changed?
Oh, it's night and day compared to even, say, 10 years ago. The resolution we have now with MRI, PET-CT scans, even intraoperative ultrasound. We're not just getting a clearer picture, it's changing the entire game plan for surgery.
Okay, hold on. Walk me through that. Like, how does that actually play out in, say, a real surgery?
Okay, so imagine you're trying to remove a tumor, right?
Yep.
But it's really close to a major blood vessel. Years ago, we'd be working with, a limited view, relying a lot on feel. But now with intraoperative ultrasound, it's like having, a live 3D map right there in the surgical field.
Wow.
Yeah, we can see exactly where the tumor ends, the blood vessels are. It's incredible.
So less guesswork, more precision. I bet that's got to be reassuring for everyone involved.
Oh, absolutely. And that level of precision, it means we can be much more conservative, too. Often we can take out the whole tumor, but preserve a lot more of the surrounding tissue. And that makes a huge difference for recovery, for their quality of life later on.
Yeah, it's got to be like the difference between using a chainsaw and a scalpel, right?
Exactly. And that actually leads perfectly into the next big shift we're seeing. Minimally invasive techniques. Laparoscopic surgery, robotic-assisted surgery. It's revolutionizing the entire patient experience.
Okay, I got to admit, the whole robots in the operating room thing,
Yeah.
It still sounds kind of futuristic to me. Break it down for me. How does robotic surgery even work? What are the benefits?
It's not like robots have taken over surgery or anything. Lapis. Think of it more as an extension of the surgeon's hands. We're still 100% in control. But the robotic system, it takes our hand movements and translates them into these super precise actions inside the body.
Okay, so it's enhancing what the surgeon can do, not replacing them.
Exactly. And because the robotic instruments are so tiny, way smaller than our hands, and they've got this amazing range of motion, we can work in these really tight spaces with so much more dexterity. Plus, the robotic system, it gives us this magnified 3D view of everything, so we can see things in incredible detail.
So smaller incisions, less trauma to the body, and probably a faster recovery time, too. Oh, cool. That's amazing. But what about the surgeons? Is there a steep learning curve with this new technology?
There definitely is a learning curve, but surgeons are kind of used to constantly learning and adapting new techniques. And the benefits for patients, honestly, they're so significant that it's really driving the widespread adoption of this technology. And it's not just about the tech either. This whole move toward minimally invasive surgery, it really speaks to a larger shift in surgical oncology towards patient-centered care.
It's about treating the whole person, not just the disease. I like that. And speaking of that, I was really interested in the concept of oncoplastic surgery. I'll admit I had to Google it. Tell me more about this approach, especially when it comes to breast cancer.
Oncoplastic surgery, that's a great example of how we're really changing the game when it comes to breast cancer. Because it's still about removing the tumor, being precise about it, but we're also thinking about, well, how's the breast going to look and feel afterwards?
So you're combining oncology and plastic surgery, basically.
Exactly. We actually work very closely with plastic surgeons, so we can kind of integrate those reconstructive techniques right into the cancer surgery itself.
Makes sense.
And what that means is less scarring, better cosmetic results, and honestly, a huge psychological benefit for patients. It's about, helping them reclaim more than just their health.
Yeah, it's not just about surviving cancer, it's about thriving afterwards, right? And this whole thing about minimizing the impact of surgery, it comes up in other areas too, like with sentinel lymph node biopsy. What difference does that technique make?
So think about it. In the past, if we wanted to see if the cancer had spread to the lymph nodes, we often had to take out a lot of them.
Okay.
And that could lead to lymphedema, that chronic swelling. Sometimes it can be painful. Well, sentinel node biopsy, that really changed everything.
Because it's more targeted.
Exactly. So we inject this special dye, sometimes a radioactive tracer too, and it basically highlights those sentinel lymph nodes, the first few where the cancer would most likely spread. So we remove and examine just those few, and we get the information we need, but with a way lower risk of lymphedema.
Less is more when it comes to complications. Okay, I get it. Now, another term I came across that I thought was interesting was intraoperative radiation therapy, IORT. It sounds like, I don't know,
Yeah.
Star Trek or something. Are you beaming radiation into people during surgery now?
Not quite that advanced yet, but with IORT, we can actually deliver a very focused dose of radiation right to the tumor bed while we're operating.
Oh, wow.
So that way we're hitting any remaining cancer cells, but sparing all that healthy tissue around it.
It's like a 1-2 punch, right? You
Mm.
take out the tumor and then zap the area with radiation.
Exactly. And for many patients, it means they don't have to go through weeks of traditional radiation after surgery, which is huge in terms of side effects, getting back to their lives faster.
Yeah, that's a big deal. It seems like every single advancement we've talked about comes back to that idea. How do we get better outcomes, but with less impact on the patient's life?
It's at the heart of everything we do in surgical oncology these days. And this whole focus on personalization, well, it's only going to get more important as we move into this new era of truly personalized cancer care.
This is where things like genetics, molecular profiling, all that comes in, right?
You got it. We're moving away from that one-size-fits-all approach to cancer. Now we can analyze a tumor's genes, figure out its weaknesses, and create a treatment plan that's really tailored to that specific patient.
So even within the same type of cancer, like two people with breast cancer, they might be treated completely differently.
Exactly. Because even within the same cancer, there can be these big differences at the molecular level. Like with breast cancer, genetic testing, that can reveal mutations, like BRCA1 or BRCA2. And those increase the risk of developing the disease.
And that information changes how you approach the surgery.
Absolutely. Let's say we know a patient has a BRCA mutation. We might recommend a more extensive surgery, like a mastectomy, even if it's caught early,
I see.
because the goal is to lower the risk of it coming back later on.
So it's all about understanding the individual's cancer, their specific situation, and then weighing the risks and benefits.
Yes, exactly. And that personalized approach, it goes beyond surgery, too. It influences decisions about chemo, radiation, immunotherapy, everything.
Wow. It's like creating a custom roadmap for each patient. Now, you mentioned neoadjuvant therapy, and I wanted to circle back to that. That's another area where we're seeing a shift in how we think about surgery, right?
Right. Neoadjuvant therapy, that's where we use chemo, radiation, maybe other therapies before surgery. And it's been a game changer, especially for larger tumors, more complex cases.
So you're basically shrinking the tumor before you even try to remove it.
It's kind of like that, but it's more than just shrinking it. We're actually trying to change how it behaves, make it more vulnerable to the treatments that come after surgery.
Wow.
And that can mean a more successful surgery overall, better outcomes in the long run.
It sounds like surgical oncology is becoming incredibly sophisticated. But with all this amazing technology, it's easy to forget that at its core, surgery is still a very human thing. It's like we've been talking about all these high-tech tools and techniques, but yeah, at the end of the day, it's the human element, that connection, that really makes surgical oncology so powerful.
Couldn't agree more. We've come a long way from, the image of the surgeon operating alone. These days, it really does take a team.
Okay, so what does that actually look like in practice, this whole team approach?
So let's say a patient, they come in, they've got a complex cancer. The first thing, they're going to meet with a whole team of specialists.
Not just the surgeon.
Right, not even close. You've got the surgeon, a medical oncologist, a radiation oncologist, the pathologist, a radiologist, nurses who specialize in oncology. And each one of them, they bring their own expertise to the table to create a treatment plan that's really designed for that one person.
Wow. So it's not just about, okay, what's the best surgical approach? It's about what's best for that patient, their whole picture.
Exactly. And you know what? When you have that kind of collaboration, you get better outcomes across the board. We see it fewer complications, shorter hospital stays, even better survival rates.
It's like that old saying, 2 heads are better than 1. But in this case, it's more like a whole room full of expert heads.
Lasses, that's a good way to put it. But even beyond the medical expertise, there's another piece of that human connection that we haven't really touched on yet. The emotional and psychological needs of the patient.
Yeah, absolutely. I mean, a cancer diagnosis, surgery, that's got to be incredibly overwhelming.
It is, and we're getting much better at recognizing that part of treating the whole person, it means supporting their emotional well-being too.
Hmm.
So these days, it's standard to connect patients with therapists, support groups, give them resources, help them through that whole roller coaster ride.
Because it's one thing to, treat the disease itself, but it's another thing entirely to help someone deal with the emotional and mental toll that cancer takes.
It really is. And we want our patients to not just survive cancer, we want them to thrive in their lives, in everything they do.
Well said. So as we wrap up this deep dive into surgical oncology, what's the one thing you really want our listener to take away from this conversation?
I want them to understand that this field, it never sits still. Every day, we're finding new ways to do things better, to deliver better care, more personalized care for every single patient who walks through our doors. And while the technology, it's amazing, really, at the end of the day, it all comes back to that human connection, that commitment to treating each person with compassion and expertise.
I've learned so much from talking with you today. Thanks for taking the time to join us.
My pleasure. It was a great conversation.
And to everyone listening, thank you for diving in with us. Until next time, keep those minds curious.